Now, the final budgets are being set in the West ahead of one of the largest reorganisations of the NHS in its 65-year history. From April the 1st, local GPs will be in charge of deciding where more than £1 billion is spent. The government hope it will improve the quality of treatment for patients, but some doctors worry it will do the opposite. Charlotte Callan has been to meet one of the GPs who will now be in charge of your care.
This leaflet is coming through your letterbox one day soon.
Founded in 1948, the NHS has changed dramatically in its 65 years. While some of the buildings remain the same, treatments are much more costly, and with an ageing population, the politicians decided it was time to change the way the NHS in your area is run. Now local GPs who are in charge of the day-to-day care of patients will also be in charge of budgets and commissioning treatment from our local hospitals. Those changes come into force from April the 1st. So the countdown has begun. The managers in charge at the Primary Care Trust in North Somerset used to control the purse strings. But soon Dr Mary Backhouse will be in charge. She's a GP in Nailsea, and she's just become the chair of the new clinical commissioning group for the area.
We're having to create an organisation effectively from scratch. We've had to go through quite a complicated authorisation process. I personally have had to go through national assessment to make sure that I'm up to the job. And so it's been quite a journey, but it's actually been a very instructive journey.
Politicians hope as a doctor she'll better understand the needs of patients than the managers who used to run things.
The idea of these reforms is that they are clinically led and that they are patient-centred. So already the practices are far more involved. So we have a team of 8 clinical leaders, 7 GPs and a practice manager who are very involved with the clinical commission group.
Her budget just for the North Somerset area is £240 million. Bristol's clinical commissioning group is led by another GP. Their budget is over £500 million. And across the West, the pot of money controlled by the 8 clinical commissioning groups is well over £1 billion. It may seem a lot, but the financial pressures mounting mean tough decisions are ahead. But not all GPs are supportive, with some claiming doctors once responsible for care will now have to make difficult decisions regarding drugs and costly treatment in order to maintain budgets. Mary Backhouse thinks she's best placed to do that.
What's important is that we do work that there is evidence that it has value. So for quite a number of years there have been procedures like varicose vein surgery or tonsillectomy where it's recognised that actually most of those operations haven't benefited people.
But will patients notice any difference in the quality of care they receive? Well, the politicians hope so, because ultimately their reforms will be judged by those very same patients and by the doctors and nurses who treat them.
Well, one doctor who's the former head of public health in the West isn't so keen on the government changes. Dr Gabriel Scally actually resigned because of them. Is that right?
Yes, I left my job really because having spent all of my career since I graduated in medicine working for the NHS and the Department of Health and been through many reorganisations, this one I just couldn't understand why it was happening, and I couldn't understand how it was going to work, and I found very, very few people in the NHS who could actually explain how it was going to work. And it's costing us a huge amount of money to recreate organisations, in fact create more organisations than we had before. If there was a desire to put general practitioners in charge, and I trained as a general practitioner, I have real doubts about the skill set of GPs in terms of running budgets of hundreds of millions of pounds. But if you want to put GPs in charge, why didn't we just put them in charge of the primary care trusts as were, without going through all this huge bill that went through Parliament, and we're now 3 years almost into the government's term of office, and the changes are only just starting to happen now.
The GP, I guess, is the person who knows the patient best. It's very personal, it's very direct. Doesn't it make sense to try to reduce it to that level?
Well, it isn't being reduced to that level. What you're having is a few GPs running a clinical commissioning group covering a whole wide area. And some of the changes that were talked about in your film, yes, if GPs don't want their patients to have their varicose veins operated upon, and some people do need their varicose veins operated upon, or they don't want patients to have tonsillectomy, well then don't refer the patients to hospital for procedures that are unnecessary. And to think that we've gone through all of this, and we still have NHS staff with only 3 weeks to go who don't know whether they've got a job and where it's going to be in 3 weeks' time.
Well, I live in Bristol. Say I go to my GP and he says, David, you need a scan. It means, doesn't it, I get a choice of where I go for that scan, or the doctor will give me more options about where I might be treated. Is that right?
Well, not necessarily. So it depends where the GPs, through their clinical commissioning group, have decided to place the contract for that. And you might be going to a community hospital to have that rather than a major teaching hospital to do that. That'll depend on their collective decision as to where
But what's wrong with that?
Contract.
What's wrong with
well,
that?
There's nothing.
Rather than just say, well, it's up at Southmead as usual. Why not? Why not let them choose which offers the best price for that particular service?
And indeed, that's what the primary care trusts were doing. I know, because I went and I've had scans both in one of our major hospitals, but also in the New South Bristol Community Hospital over the last period of time. Those choices were there, and they were being made available to GPs and their patients. This is an unnecessary, expensive and bureaucratic reorganisation when we were promised no more top-down reorganisations.
OK, well, let's bring in both of our politicians. Anything you can say, do you think, to convince him that this is actually a good idea? Why did you vote for it, both of you?
I've been along to see my commissioning group in South Gloucestershire, and I said to them, will it be a revolution on April? And they said, no, it will very much be evolution. It will be, yes, there's been a significant shake-up, and I accept that, and there's always a cost and a disruption to that, and perhaps it could have happened, you know, quicker so people knew what was going on. But the basic difference, as we've heard, is the NHS's money is going to the hands of doctors. And people who've said this is, you know, tearing up the principles of the NHS, it's actually the opposite. These decisions, these clinical decisions, were being made, but they were being made by people who work for primary care trusts, who may not have been clinicians, and now the doctors are in charge. Yes, they will appoint, you know, accountants and people who do those things well, but they'll have the oversight, and that seems to me a good thing.
Do you accept that?
Well, GPs could have taken over the primary care trust and been in charge of those, and no one has satisfactorily explained why that wasn't done or why it wasn't possibly done. But there is a fundamental issue at the end of this. When patients go in and see their general practitioner, they want to know that they're getting the full attention of their general practitioner, and the GP is deciding on the basis of their needs and will fight for that patient to get the treatment they need. And there is a potential concern amongst patients and some GPs that every time you see a patient, you see a budget that you're responsible for.
John Penrose.
Well, but that has been the case for a very long time. The GPs have always had to make these trade-offs, work out how best to treat someone. They have a budget which they've got to deal with. And all that's happening now is that the GPs have more of a whip hand. I mean, with all possible due respect, I don't think that something that says former health service manager complaining about the fact that managers aren't in charge of the health service any longer is a terribly surprising piece of news.
Well, unfortunately, I never really worked in health service management. I'm a public health doctor, and I've been a director of public health.
Yeah, well, which is management of a chunk of the
it is about managing the health of population, and what we should be doing is doing what we need to do as a society about things like alcohol, tobacco, obesity, and so on, and not being distracted by an unnecessary, costly, bureaucratic restructuring. And that's the feeling of the overwhelming majority of doctors and the overwhelming majority of health service staff.
OK, we have to leave it there. Thank you very much indeed for joining us today.